The obesity paradox has been absolutely fascinating. And a new paper coming up in JACC is taking a look at, does it apply in patients with diabetes? And I'm with Pierluigi Constanzo from the University of Hull, New York in the UK, and a Young Investigator Award nominee for this particular paper. Congratulations for the honor. And let's start at the very top. Why did you do this paper? Why did you do this research to begin with?
All right. Why did I do this? Because basically my academic position is a joint fellowship between a Department of Metabolic Medicine and Cardiovascular Medicine. So I had to bring together the research needs of different educational supervisors. So I focused my attention on a topic that looked simple, straightforward. Is obesity causing more harm in terms of survival in people with type 2 diabetes? The answer may seem yes, but actually it's not really clear at the moment because the studies so far have not proven that obesity causes more mortality in patients with type 2 diabetes. Some studies have proven, some others have not. But the lack of consistency for these results is basically due to the fact that these studies were not properly designed to look into that, or because of the short duration of the follow-up, or because of the inadequate population sample size. And then I found that in my department I could have looked properly into that, because we have a population of diabetic people followed since 1995, more than 10,000. It's a big population in a single center into the real world. So basically what I did, I put this population into a database, and then I collected all the cardiovascular events, the comorbidities, that is the most important thing, and the survival. The result is that overweight and obese diabetic patients, type 2 diabetes mellitus, survive longer than people with normal weight. And with normal weight, a body mass index less than 25. It seems paradoxical, and it was paradoxical to me initially, so I looked into that properly, trying to find out where was the statistical trick. And to be honest, in my view, there was no statistical trick. We really did a lot of analysis about it. The explanation that we give, because at every result in science, we need to give an explanation behind that,
Sure.
And is that the diabetes as such in people who are overweight or obese may only be a physiological response of more insulin resistance because of more abundant adipose tissue. Instead, the fundamental question is why someone with diabetes, why someone who is normal weight develop diabetes. So it should not, in theory, actually. Why is got insulin resistance? Possibly because it's more prone to have a severe metabolic disease. If we sit back one moment, we actually don't know what is the cause of type 2 diabetes, really. I actually have my own theory. It may look a bit bizarre, but we are in an embryonic phase, but actually I think that the secret is in our gut, in terms of microbial gut flora, and the way we feed these bacteria. And possibly the high refined sugar diet, as in the Western countries, cause an imbalance in this microbial flora, and then this causes a chronic inflammation. And what we see is hyperglycemia. So we got metabolic insult given possibly by imbalance in bacteria, and then we see the hyperglycemia. It's like infection and fever. So it seems like in this moment for diabetes, we're treating the fever, so the hyperglycemia, but not the metabolic insult. This theory is very embryonic. It's only my personal view, to be honest. What is a fact that we're going to show is that overweight and obese diabetic people survive longer, and that's a fact at the moment.
Do you like doing research? This is a Young Investigator Award nominee standing in front of me. Do you have fun doing this? This isn't even your first paper in JACC. You've had others. What's your secret?
Well, don't think I have a secret. I actually enjoy doing research. I think it's like my hobby. I have other hobbies, thanks God, but I really enjoy to do that, and I spend most of my time doing that. And it's like a bit of passion. I sort of get self-satisfaction of setting out an idea and trying to get the results. It's like placing a bet and, trying to win.
Yeah, exactly.
And I'm also actually hugely in debt to my first professor. I mean, my first education supervisor was Professor Perone Filardi in Naples, that have sort of given me the joy of doing research and also the freedom and the independence to do what I really fancy in research. Because if you don't fancy something and then you get bored, you don't do. And of course now I'm grateful to Professor Cleland, Professor Clark and Atkin that gave me great chance to carry on with this research.
Thank you very much for chatting with us for a few minutes. And the paper is in JACC, so please look for that with Dr. Constanzo et al. And for CardioSource World News, I'm Executive Editor Rick McGuire.